All right, it's recording. Yay. All right, well, thank you guys so much for being here. I really, really appreciate this. This is going to be a review of head and neck anatomy, specifically osteology of the skull. It's a review for the National Board exam. Rebecca, you can go ahead and put the next slide. My name is Shannon O'Brien. I was in your shoes about 4 years ago. I'm a graduate of the 2010 class of dental hygiene, one of Ms. Southerly's favorite students. And then after I finished here, I did my bachelor degree completion at Old Dominion University. It's completely online. It's great. So I've got my BS, and now I'm working on my MS in dental hygiene, same way as Old Dominion University. And it's an online class. So just to go over, I want to thank you all for coming.
Thank you.
Yeah, oh, thank you. So why, oh wait, not yet. Basically, why did I choose head and neck anatomy? It's not glamorous. It's a lot of memorization, and it's very basic, but it's a great foundation for your studies and for the national boards. It's something that never changes. And it's not like periodontology where new treatments come about and everything. It's just something very solid. And I picked it because I want you guys to know this stuff frontwards and backwards. I don't want you to have to spend like 5 minutes in a case study saying, oh my God, where's the lingula? What is it? You know, I want you to use your critical thinking skills. I want this to just be like muscle memory, like a reflex. Like as soon as you read the word, you know where that bone is. So, okay, and you can go to the next one, Rebecca. And, okay. This is pretty much what students do in head and neck anatomy. It's pretty boring. It's a dry subject. I'm not going to lie, you know. But I'm going to try to make this more interactive and fun. I want you guys to participate. You know, if you have a question, just call out. This is very informal. I don't want you to be, you know, intimidated or anything. And go to the next slide. I want you to be like this girl. I want you guys all participating, really. You know, calling out bones. You know, I've got some exercises, some questions. Don't be afraid to answer. If you don't like to talk in class, that's fine too. Your level of participation is up to you. So, all right, next slide. And, all right, this is you guys getting ready for the National Board exam. That's why we're here. Our motivation to be here is that we want to pass this exam, and we want to pass it really well. When I was looking at my scores a couple weeks ago, I noticed that the anatomic sciences, there was only 15 questions out of 500 for the whole exam. 15 questions. I'm like, well, gosh, that's 3% of the exam. What's the point of studying that? Well, then I looked a little closer, and I realized that patient assessment, there's 68 questions on patient assessment. There's 56 on radiology. There's 150 case studies. All of these things are going to use dental anatomy as a basis for your answer. So this is the easiest part to memorize. You want it just to be there quickly. Okay, as far as your knowledge base, I know you guys all took, did you guys have Dr. Kelly for head and neck anatomy? Okay. Oh, you can go to the next slide. I think I got a picture. Oh, there he is. All right, Dr. Kelly. We all had him first semester, which seems like a million years ago. And you're like, how am I ever going to remember this information now? I mean, I remember going back for the national boards, and I was like, what is a vomer? I had no idea. So we've got the base there. We just kind of want to bring it out. Have you guys been to any like national review, board review, or anything like that? You guys have? So it's going to be a little fresher in your mind. What about group study? Have you guys started doing group study for?
A little bit.
Yeah. Okay. That'll all help. And you know, basically, with this. After you're done this class, you are going to know the 22 bones of the skull so well. I promise. It's like a money-back guarantee. We're really, really going to drill it into your head. So, all right, next slide. Okay, here's our objectives for today. We want to discuss 3 learning styles and 3 memorization techniques. We want to describe the functions of the bones in the skull. We want to identify the bones in the neurocranium and the viscerocranium, and some associated landmarks. I'm actually going to do a second class that concentrates more on landmarks. So today we'll do some, but next time we'll do a lot more. We want to define anatomical terminology and views of the skull, and then we want to do some critical thinking. We want to formulate a diagnosis based on empirical evidence. And empirical evidence is, does anybody know what that is? That's observation. So, okay, step into the next slide. Thanks. Okay. 3 types of learning styles. We've got the visual, auditory, and kinesthetic. The visual learner, they like pictures, charts, written words, things like that. Auditory, they remember by hearing somebody tell them how to do it, or even telling someone else how to do it. And then the kinesthetic learner, they're more of a hands-on approach. Now, why is this important to you guys? Researchers have determined that people prefer one of these styles. So if you're a visual learner, you're going to read really well by, you're going to learn really well by reading the textbook. But if you're a kinesthetic learner, maybe this lecture isn't the best format for you. So we want to take that, we kind of want to modify things. If you're a kinesthetic learner, as I'm going over pictures and diagrams, maybe feel your head. You know, this is my occipital, this is my frontal. Kind of make it more relative to your learning style. Maybe even doodle a little bit, you know, draw a mandible on the paper, whatever. But basically, I want you guys to be comfortable, know your learning style, and be comfortable with it, and really focus on that. You don't want to be a visual learner that's got a human skull the night before your board. It's like, oh my God, what am I doing? You know, you want to be concentrating on your area of expertise, and then you can bring the other ones in to kind of supplement that. Okay, the next slide. And this is a great way to determine what kind of learner you naturally are. If you get a desk from IKEA and you're reading the directions and looking at the diagrams, you're visual. If you're somebody that calls your friend and says, you know, tell me how to do this, you're going to be the auditory learner. And if you just throw it all on the floor and start putting them together, you're kinesthetic. So, or you could ask your boyfriend to do it. You're a genius. So, all right, next slide. Okay, so memorization techniques. This is very important for this type of subject matter. First of all, we want to organize the information, and I've tried to do that for you with an outline. And that just makes it easier to remember it by grouping it together and making it logical. Okay, then you want to make connections and associations. I've got lots of these throughout the slideshow, and it seems like, to me, the more outlandish the connection or association, the more fun it is, the more you'll remember it. And I remember stuff from when I was in school, you know, first year, and we said something just completely stupid, and we're all giddy and started laughing, and I'll still remember it today. So we'll try to do that here. And then visualize the information. Once we're done with the slide of, like, say, the frontal view, try to just kind of close your eyes or whatever and picture it in your mind. And just, you know, see it and see if you can pick it out like that. And that just kind of reinforces the learning. So, okay, the next slide. Oh, okay. This is that's the skull. That guy has one bone, and that would be great. If that was
alien.
Anyway, all right. So, so osteology is skull. Osteo is bone. Ology is study of. So study of the bones of the skull. Okay. Next slide, Rebecca. And okay. So the functions of the skull bone. There's three main functions. Number one is to surround the brain and protect it from injury. The brain is very vulnerable. So the bones being mineralized like they are, they just add some protection to it. Form the facial skeleton. I mean, just imagine trying to breathe without your nasal bones. It would be highly unsuccessful. And then also participate in the growth process of the jaw. And we'll talk a little bit about that today, but mostly next week when we get into the landmarks of the maxilla and things like that. Okay, and the next slide. Okay, so we have 22 bones. That's the number you really want to remember, is 22. That excludes the 3 ossicles in each ear. So if you include the ossicles, it's 28, but 22 is the number you really want to remember. The bones in the skull are single or paired. There's no triplets, quadruplets, anything else, just single or paired. And then we're going to divide them into 2 categories. The first category is the neurocranium, and that means the bones surrounding the brain. And then the second category is the viscerocranium, and those are the facial bones. So, am I going at a good pace for you guys? Yeah. Okay, just let me know if I'm not. I'm just going to turn my camera here. Okay. All right, next slide, Rebecca. Thanks. Okay, just to refresh your memory, this is just trivia more than anything else. The ossicles, malleus, incus, stapes, and in anatomy, they always say the malleus is like a hammer, incus, anvil, and stapes stirrup, which you guys probably remember. So, all right, and the next slide. Okay, so starting off with the neurocranium, we've got 8 bones in the neurocranium. And if you look down the column of single versus paired, you'll notice there's 4 single bones and then 2 paired bones. So you can say the neurocranium is mostly single bones with a couple of paired. So first we have the occipital bone, and it's back here. Parietal bone, kind of up top. Frontal bone, forehead. Temporal bones on the side. Ethmoid and sphenoid, they're kind of behind the eyes, so you can't really touch them. Here's a mnemonic to help you memorize the bones of the neurocranium. Old people from Texas eat spiders. So we've got the O for occipital, P, parietal, F, frontal, T, temporal, E, ethmoid, S, sphenoid. Old people from Texas eat spiders.
Could have said sweet.
Okay, old people from Texas eat spiders. And now, without looking at the last slide, we're going to name the 8 bones of the neurocranium. Okay, what's the O stand for? Occipital. P,
Parietal.
F,
Frontal.
T,
Temporal.
E,
Ethmoid.
S.
Sphenoid.
Right. Okay, next one. All right, now we've got the viscerocranium. So we had 8 bones already out of 22, so it leaves us with 14 bones. Now if you look at the viscerocranium, you're going to notice there's more paired bones than single bones. In fact, the only single bones are the vomer and the mandible. So we've got the vomer, the inferior nasal conchae, the nasal bones, the mandible, the maxillae, the palatine bones, zygomatic bones, and lacrimal bones. Okay, and then we have another mnemonic. It's called Valerie cannot make my pet zebra laugh. So the V is for vomer, the C, we took a little liberty and made it conchae, yeah. N for nasal bones, M for mandible, and then another M for maxillae, P palatine, Z zygomatic, and L lacrimal. Valerie cannot make my pet zebra laugh. Next slide, Rebecca. Okay, that's, you guys know who she is? Valerie Bertinelli. She's a comedic actress, so that zebra looks like he's laughing, but he's really not. He's growling. So, all right, so Valerie cannot make my pet zebra laugh. Let's go ahead and name the bones again. The V, C, inferior nasal conchae. Yeah. Okay, and then N, nasal, M,
Maxilla.
M again,
Mandible.
right, P,
Palatine.
right. Parietal is on the neurocranium.
Yeah.
Okay, Z,
Zygomatic.
and L,
Lacrimal.
lacrimal. Very good, very good. Okay, let's go to the next slide. And let's catch up with you guys. Okay, important terms. And you guys probably know these inside out and backwards, but we'll just go over them one more time. We've got the suture, which is the joining together of 2 or more bones. We've got foramen, a short tube-like opening through a bone. A canal, which is a long tube-like opening through a bone. Fossa, round, wide, relatively shallow depression. Aperture, a hole or small opening. Eminence, a projection. And process, a projection or prominence. And these all describe landmarks.
What will be the example for aperture?
Aperture, you know what, you don't see it very often, but I think it's the same as a foramen, honestly. It's just a small hole or opening. Yeah, I can't think of any offhand that use that, but just be aware that, you know, if somebody does ask the question. So, okay, so what's a foramen for? Yeah, that's a good example. Right, nerves. Anything else go through a foramen? Besides nerves, blood vessels, yeah. And there's a very large foramen at the base of the skull in the occipital bone. You guys know what that is? Magnum. Right, foramen magnum. Magnum means large. There's a foramen ovale too, but the foramen magnum, the medulla oblongata actually passes through there, and that's huge. So you do have a hole in your head. So, okay, and next slide. Okay, so we're going to do these learning review questions throughout, and they're really, most of them are pretty easy, but you know. So how many bones make up the human skull excluding the ossicles?
22.
Okay, what if you included the ossicles?
28.
Okay, what about neurocranium? How many in the neurocranium? 8. Yeah, viscerocranium?
For the members of the community that want to go through some of this inventory, do you know when is a good time for them to sort of come in and do things?
Oh, we'll be done by 2 o'clock. Is that okay?
Oh, 2?
Yeah.
Oh, okay, well let me find out.
Okay, all right. Okay, so, and you can go ahead to the next slide, Rebecca. Okay, right, the answer was 22, 8 in the neurocranium and 14 in the viscerocranium. And one time, I remember Dr. Kelly one time, he gave us a quiz and said 28.
Oh, yeah.
That was really sneaky.
Yeah.
So,
He did that for
shame
us
on
too.
him. I know, it's like you've got the same bag of tricks for decades or fanny pack full.
Otherwise, our life would be too impressive.
Yeah, it would be too tedious if not. All right, so next slide. Okay, another question. Which of the following bones is not paired? Temporal, vomer, lacrimal, or zygomatic?
Vomer.
Vomer, right. Vomer is part of neurocranium or viscerocranium? Okay, let's go to the next slide. Vomer, as we said, and then the temporal bones are paired and part of the neurocranium. Lacrimal and zygomatic are also paired, but they're part of the viscerocranium. And this knot, you're going to see, for some reason, the national boards really likes negative questions, you know? I mean, it's just crazy, like what not isn't, doesn't, you know? so pay a lot of attention to that, because it can really trip you up. So, okay, and the next slide, we got that. Okay. Oh, what do old people from Texas eat? Snails, snakes, spiders. And next slide. All right, you're right. All right, and let's just name these bones again. Up, O,
Occipital.
T,
Parietal.
F,
Frontal.
T,
Temporal.
E,
Ethmoid.
S.
Sphenoid.
Okay, good. They're a good time. Okay, next slide. All right, now those questions are really easy. They're just very basic, so we're going to get harder ones later, just to warn you. All right, then next slide. Okay, views of the skull, and I know you guys know this already too, but just to remind you, we've got the anterior view, which is the frontal view. Lateral is the side view, also profile. Then we've got an inferior view, which is beneath, so it's like you're working under a car looking up at the engine. And they say that's the hardest view for students to understand, but I don't know, I never thought it was that bad. And then interior, that's like when we cut your skull open and look at it. So, okay, the next slide. Okay, so this is our first diagram. So what we'll do is we'll just go bone by bone. Up here we've got the parietal bone, and then we've got the frontal bone. And then we've got the sphenoid, and the sphenoid is actually, it's a bone that's shaped like, they say it's shaped like a bat or a butterfly. It's got the greater wing and the lesser wing, and then it's got the body. So it's kind of behind the eye there. And then we've got the ethmoid. The ethmoid is here, and then it also comes down here. And then, do you guys know what these are by chance?
Nasal concha.
Right, they're which nasal concha?
Inferior.
Right, inferior's down here and middle's here. Now we saw the inferior nasal concha as part of the viscerocranium, right? But the middle nasal concha was not there. Do you guys know why? It's not a bone. Right. Thank you, Dawn. Very good. Yeah, the middle nasal concha is not a bone. It's actually a projection off of the ethmoid bone. So, and there's also superior nasal concha, which you can't see here, but this is kind of a little something that could catch you on. Dr. Kelly, I'm sure would. So, all right. So then we did the ethmoid, and then this is the perpendicular plate of the ethmoid, and we're going to look at the ethmoid in a little more detail later. Okay. So moving around, we've got the mandible here. That's an easy one. Vomer is right here at the base of the nose. We've got the inferior nasal concha, the maxillae. The zygomatic bone. Okay, and then here, look here, the lacrimal bone is all the way closest to the nose. And then when you move out, the ethmoid bone is next. And here you can see a little bit of the palatine bone, but really, I like to think of the palatine bone as back, the hard palate. And then we've got the nasal bone here. So one thing I want you to kind of think about in greater detail is the lacrimal bone in the middle, followed by the ethmoid, and then the sphenoid is more out towards the lateral area. Okay. Anybody know what's wrong with this picture? How many bones should we have in this picture? 22, right. Let's count how many we have. Parietal bone, that's 2, right? Frontal bone, 3. Sphenoid, 4. Ethmoid, 5. Mandible, 6. Vomer, 7. Nasal concha, 9. Maxillae, 11. Zygomatic, 13. Palatine, 15. 16, 17 for lacrimal, 18, 19. We've got 19 bones. What's missing?
Occipital.
Right, right. There's a
Zygomatic, you count
temporal.
one, it will be two.
Zygomatic is two. It's a paired
Yeah.
bone. Yeah. So right, we've got the temporal over here. It's just not labeled, and then the occipital. You can kind of see through the mandible there, here at the base of the skull. So that's just keep you on your toes. So all right, and the next slide. Okay, another learning review question. Which bones of the viscerocranium are not paired? So we want to look at two things here. We want to look at viscerocranium and not paired. So we want a neurocranium bone that's single. So it's safe to say the mandible is one of these answers. Do you get the mandible? Yay. Okay, so ethmoid, is that single or paired? Ethmoid?
Single.
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 Right.
Single.
Ethmoid. We were just talking about with the middle nasal concha and the superior nasal concha and the perpendicular plate. Okay, sphenoid is single or double or paired?
Single.
Single, right? That's the one that looks like a bat or a butterfly. Vomer?
Single.
Single. Okay, so that meets the criteria that it's single. Now, is the vomer part of the viscerocranium or neurocranium? Viscerocranium. So I think C is our answer, but let's just look at D just to make sure. D is the palatine bone and the mandible. So palatine, yes, it's part of the viscerocranium.
But it's paired.
Exactly. Very good. So, okay, next. And Dawn gets extra credit again. All right, so the vomer and the mandible. So that was good. Okay, and the next question. I'm just going to check my camera real quick to make sure we're going. Okay, all right. Sorry, I'm living and dying by this recording. All right, so now we're going to, okay, lateral view. All right, we'll just go around again and kind of name the bones. Just a different view. The frontal bone here, and then the sphenoid, you can see it kind of in front of your temple, in front of the temporal bone there. We've got the ethmoid. You really can't see the ethmoid very well. The lacrimal bone, like right in the corner of the eyes. I call this the lacrimal bone because, you know, tear dust, whatever. Not very original. So, okay, then the nasal bone here, zygomatic bone, maxilla, and then this we're going to get a couple more landmarks in this picture, the alveolar margins. Those are on the maxilla and the mandible, also called the alveolar ridge. Does anybody know any feature about that that's important or interesting? They hold the tooth sockets are in the alveolar ridge. So, okay, then we've got the mandible, and here they divide the mandible up into two parts. We've got the body of the mandible and then the ramus of the mandible. And then we've got the mental foramen, and we said foramens are for... Right, good, good. Okay. All right, then we've got, here's the temporal bone here in orange. So temporal's got a lot of landmarks on it. We've got the styloid process, the mastoid process, the external auditory meatus, and then the zygomatic process here. So what do you guys think these processes are for, like especially the mastoid and the styloid? Right, and muscles. Yeah, they're an attachment for ligaments and muscles in the neck. And so just moving right along, we've got the occipital bone. Okay, then we're going to name some sutures. This is the squamous suture, and that's between the temporal bone and the parietal, obviously. We've got the lambdoid suture, which is between the parietal and the occipital. And the lambdoid suture it's an inverted V shape. So if you look at the back of the head, it's going to look like that, like an inverted V. And there's another name for the lambdoid suture, which will make your life easier. It's called parieto-occipital suture, too. So, but I'm sure you will use that name instead. Okay, then we've got the parietal bone and the coronal suture. Coronal suture, crown. Think of a coronation. That's it's right on top of your head there. Now there's a landmark that's not listed here. That's just, it would be right around here. Anybody know what I'm talking of? Very good. Temporal fossa. Temporal fossa also actually involves 4 bones. Can anybody name what they are?
Frontal, parietal, temporal, and sphenoid.
Right, frontal, parietal, temporal, and sphenoid. Very good. Okay, and then, oh, and I just had one note about this squamous suture. Most sutures, the bones are right against each other. The squamous suture is unusual because it overlaps. There's overlapping there. And that's important because sometimes people with TMJ disorder, those type of issues, they think that that suture, the overlapping, there's something wrong in there, and that causes more TMJ issues. So,
Can I ask a question regarding TMJ? We were just discussing that Dr. Kelly said there's 3 bones that articulate to make up the TMJ. What?
oh gosh. Miss Sutherland, you're going to have to, let's see.
3.
There's 3.
bones. Well, it's obviously the mandible.
One is mandible.
The mandible, and then the temporal, and then the zygomatic, I
Yeah.
think. Because this is part of, you've got the condyle here, and then you've got, that's your articular eminence, is that it? And then,
Your sphenoid doesn't come in back there?
Dr. Kelly said
No.
it was 3 because you have 2 temporal bones
Yeah.
on either side.
Two
That's
temporal.
why.
that's
He
right.
was
I
tricked
remember
because you
now.
have a temporal bone here and a temporal bone here, and
Yeah.
they both go with the mandible. So
That's
it's 1,
right.
2.
So it's 3 bones, but not 3
Yeah.
It's a
different
miracle
types of
nobody
bones.
shot that man.
It's, yes. It
Saying.
truly,
That's how he
truly
was to
is.
us.
So, all right. Yeah. but you're absolutely, and now that you said that, he used the same trick on us 4 years ago, 5 years ago. So, yeah, so there you go. All right, and next slide, Rebecca. All right, this is, you guys know who this is?
Reese Witherspoon.
Legally Blonde, right? Elle Woods, Reese Witherspoon. What's notable about Reese? What's distinctive about her
She's
face?
got a
Huge
prominent,
mandible.
Yeah.
Oh, look at that.
Right, her chin. It's, yeah. Now, is that the chin bone?
Mandible.
Mandible, yes,
Body.
yeah. And then, does anybody know what part of the mandible? That's a little more specific. It's, go ahead to the next slide. It's actually the, right here, the mental protuberance. Mental protuberance, yeah. And we'll actually, in part 2 of the class, we'll go over all these landmarks, but for now we're going to keep it more general. But the mental protuberance. So next time you see Reese Witherspoon, you say, she's got a cute heart-shaped face because of her mental protuberance. Okay, and next slide. Okay, another learning review question. Now we're going to think back to the lateral view. Which landmark looks like an earring in the lateral view, and to which bone does it belong? So go back a couple of slides and just think about it. Okay, so we're going to, the mastoid process on the occipital, is that a possibility? Anybody think? No, because the mastoid process isn't actually on the occipital, it's on temporal. Right. Zygomatic process on the temporal. No. Styloid process on the temporal?
Yes.
Yeah. Mental foramen on the mandible? No. Not even close. So, all right, next slide. And yeah, so styloid process on the temporal. And you go ahead, Rebecca. Okay, now this is the inferior view. This is the one where you're kind of up, looking under a car, kind of. So we're just going to go start off with there's a bunch of foramen down the side here. We'll get into those a little bit, but not too much. But okay, so we're going to start off with the foramen lacerum. That's right here. The notable thing about this foramen is that in an adult, it's filled with cartilage. So it really doesn't have a lot of function. Nothing of importance passes through there. The foramen ovale, that is on the here on the sphenoid, and does anybody know what nerve passes through there?
Oh, I just know it was
Mandibular nerve passes through there, so that's a pretty important one. Okay, and then I love ones like this where it's so easy. The carotid canal, what comes through there? Yeah, thank you. The jugular foramen. Don't you wish all the questions were like that? Then we've got the stylomastoid foramen, and there's that styloid process, and then the foramen magnum. Now we said about the foramen magnum, that's huge. That's at the base of your skull, and that's where your medulla oblongata passes through. And and the medulla oblongata, it's actually part of the brainstem, so it's the lower part of the brainstem, and then the pons is the upper part of the brainstem. And I didn't remember that. I had to look that up. So anyway, the foramen magnum. I like that one just because it's so big and you can't miss it. So then we've got the external occipital crest, I think that's pronounced nuchal lines. Honestly, I've never seen questions on those. So, and then we've got the lambdoid suture. Does anybody remember what shape we said that was?
the inverted
The inverted V, and it connects which bones?
occipital.
Very good. Yeah, so it should be called parietal occipital. So, okay, then we've got the temporal bone, and it's huge. Mandibular fossa. Anybody? Okay, what's a fossa first of all? Depression. Right. And what do you think goes in the mandibular fossa on the temporal bone?
The condyle.
The condyle of the mandible. Very good. Yeah. Okay, and then we've got the styloid process, which always looks very vulnerable to me. It just looks like it could break off, but I guess not. Okay, zygomatic arch. Anyone know a layman's term for zygomatic arch? Cheekbone. And zygomatic arch is made up actually of the zygomatic process of the temporal and the temporal process of the zygomatic.
Yeah.
So that's, you know, that was so confusing to me at first, but then I'm like, wait a minute, it makes sense. You know, but because it's like different bone names on the other bone, it's hard. So, okay, then we got the sphenoid again, and we said the sphenoid was what shape?
Butterfly or
Like a
bat.
butterfly or bat, whatever, yeah. And then here's the,
Ooh, that kind of looks evil.
I know, doesn't this thing look like an alien of some sort?
Bug.
Or, yeah, something weird. But that's the vomer. That's the one on the anterior view. It's like at the bottom of the nose there. Got the, what?
Cicada.
It does, yes. The frontal bone we can just see a little bit of. Okay, we've got the palatine bone and the maxilla. What's this area called?
The hard palate.
Hard palate, right. So the hard palate's made up of the palatine bone and the maxilla. And we said the vomer. This green area, that's not labeled, but what do you guys think that is?
The ethmoid.
Ethmoid, yeah. Very good. Very good. Okay, next slide. And another question.
Ooh.
Okay, a pizza burn. Have you guys seen any pizza burns in clinic?
Yeah.
Really? Oh, you have. Okay,
Well,
yeah. Seems like they're everywhere. So, okay, pizza burn on the roof of the mouth will affect the skin covering which bones? Would you say the mandible and the maxilla?
Now you're so far.
Palatine and maxilla, right. Palatine and the maxilla, that's what makes up the hard palate. So, all right, next slide. And palatine and the maxilla, and the next slide. And ouch! That looks like it hurts. So, all right, let me just check my tape real quick. And we're still good? Okay. Sorry, I'm so paranoid, I know. I was like, that's Miss Southerly. I was a very paranoid student. Wasn't I?
Detailed, very detailed.
Yeah. So, all right, and the next slide. Okay, so here we've got the interior view. So this is basically you've cut off somebody's head, these sick people, and you're looking at the top of it. So I like this view. I think it's very cool. It's very interesting, and it's kind of fun. But anyway, here's the frontal bone. This area, does anybody know that, it's hard to tell, but that's a depression of some sort. Do you guys remember what that's called, anybody? Okay, that is actually the anterior cranial fossa, and that will hold your frontal lobes. So I think of like an egg carton kind of thing, and then you just put your frontal lobes right in, and that's it. So, okay, so then we have, that's the frontal bone. The ethmoid bone. We touched on that a little bit. We know that it's got the perpendicular plate that comes down, and we also said it's got the middle nasal concha and the superior nasal concha. Okay, we're going to look at the ethmoid bone a little more because it's kind of a cool bone, you can say that. So we've got two landmarks on the ethmoid bone. We've got the cribriform plate, and the cribriform plate is going to be kind of a horizontal structure. And then we've got the crista galli on top of there. So they're going to be perpendicular to each other. So the crista galli is going to kind of come off the top there. And the crista galli is interesting because, first of all, it's Latin, and it means crest of the cock. So you guys won't forget that, I'm sure. And then it also holds, does anybody know what the crista galli is for?
Doesn't it hold like a pituitary?
You're close. That's actually going to be on the sphenoid, the sella turcica. Yeah, the crista galli, it is, there's something called the, let me make sure I say it right, the falx cerebri. That's dura mater, and it divides the brain into the right and left hemispheres. So you think about...
The heads are nodding. Oh, yeah.
Yeah, it sounds familiar. But I think of it as like a mohawk made out of dura mater. It goes right through your head, and the anterior attachment is on that crista galli. That's what it's for, to attach that. So, okay, then we'll move down to the sphenoid bone and the sella turcica. Sella turcica is Latin for Turkish chair. And this area, there's a depression here, and that's where the pituitary gland will sit. It's called the hypophyseal fossa, and it holds the pituitary gland. And this is also known as the body of the sphenoid bone. Then we have the foramen ovale, we said the mandibular nerve. We've got the jugular foramen, and jugular foramen is actually made up from two bones. It's half temporal bone and half occipital. Foramen magnum, occipital, parietal back here, the internal acoustic meatus, temporal bone, and then the sphenoid bone. You've got the greater wing of the sphenoid bone and the lesser wing of the sphenoid bone. So, any questions about that? Okay. And we can go to the next. Okay, I just wanted to take a closer look at the ethmoid bone because I think it's really cool. This is the perpendicular plate, and when you're looking at the anterior view, it's going to be like right here in your nose. So that makes up more than half of the nasal septum. The perpendicular plate together with the vomer make up the nasal septum. Then you've got your middle nasal concha and your superior nasal concha. And like we said, those aren't bones like the inferior nasal concha, they're just projections. And then we've got the cristagalli here, and the cribriform plate would be there, like horizontally. So, okay, next. Oh, cristagalli, crest of the cock. See, I told you guys. That's his cristagalli. So, rooster, yes. All right, next slide. And, okay, you guys know who this is? Dawson, right, Dawson's Creek. What's interesting about his face?
He has a large
forehead. Yeah, his forehead. Next slide.
I think it's his mandible. He's large.
You think so? I always hear people talk about his forehead. So if you go to the next slide, we'll, you need to any more bones to cover his forehead. So what bone is he covering there?
Frontal.
Frontal, yeah, very good. That's an easy one. Poor James. All right, next slide. And frontal bone. So, all right. And we can go ahead to the next slide, Rebecca. Okay, this is one of those outlandish associations. I know it's gross, nose picking. Okay. There's a lot of bones in the nose, and this is going to be just kind of a good way to remember them. So, picture in your mind your anterior view of the skull. If you're just doing a little pick, what bones, Miss Southerly will never forget this, what bones are you going to encounter on your way up? What are the first bones that you're going to encounter?
Your
Vomer on the medial, yeah, and then what about laterally? What do you think you would encounter? Which is really
Nasal bone.
What's that?
The concha.
The inferior nasal concha. Yeah.
Don't be shy.
Okay, yeah, don't be shy. Just feel up there. Okay, so you're gonna, and then picture in your mind. Let's get pictures of people nose picking. All right, you go up a little farther. You're in your car. You feel like people can't see you. You're up there. What are you gonna hit next? What going up? What are you gonna hit in the middle? What are you gonna hit on the outside?
Nasal bone? No, the ethmoid.
Right.
Pretty far
Ethmoid.
off.
It's going to be, well, let's talk specifically what you're going to get.
The perpendicular plate.
Plate of the ethmoid, and then on the outside you're going to have the middle nasal concha, right?
How many knuckles are you up now?
Yeah, well, going in for the big dig next. So, all right, if you go up even further, I don't know why, but if you go up even further, what are you going to get to if you go? The cribriform plate.
Oh.
Right. The cribriform plate is horizontal. It's going to stop you from getting into your brain, hopefully. So, unless you use a lot of force. So, if you go to the next slide, we'll just look there. Okay, like your vomer and your perpendicular plate of the ethmoid, and that's what keeps you from going back and forth. You got to stay on your own side. Then we've got the inferior nasal concha. Then we get up to the middle nasal concha. Oh, we forgot the nasal bones. Those are going to be on the outside. So, it kind of, it forces you to think, you don't want to pick your nose, but it forces you to think about how, what you're going to encounter as you go up. So, okay, let me just,
Yes, this doesn't affect the bone, does it?
I'm sure it eats away the bone, no?
what's that? Picking your
Somebody
nose?
were to
Oh,
do
you know
like
what?
that
I read a lot
tiny
about this, and you can actually perforate your septum,
Yeah.
or
Yes.
you can deviate your septum, or there's all kinds of nasal trauma.
I would just, if you did a lot of cocaine, for example.
Yes, cocaine will, it'll destroy your septum. You've probably seen, you can look online and then look at, you can find images for days of that kind of stuff. It's really scary and disgusting. So we've got, that's the nasal septum, and that can be deviated in accidents or things like that.
So when it's deviated, that means that it just kind of bends to like one side.
Right, it's not broken, it's bent.
And then does that just prevent you from breathing out of a certain nostril?
It does. It can prevent you. well, it diminishes your breathing out of one nostril. It can be a certain percent deviated, and then like you might lose like 50% of your breathing capacity on one side of the nose. What's interesting is I actually have a deviated septum, which I've never had fixed, and the side to which the septum is deviated is actually my good side now because the other side is inflamed from years of overworking. So it's, yeah, the nose is it's really interesting. So you can go to the next slide, Rebecca. Okay, the ethmoid bone, just to illustrate again, the perpendicular plate, this is the cribriform plate where you would stop before you get to your brain. You wouldn't reach the crista galli because the cribriform plate is like underneath it and it's sitting on top like that. So next slide, Rebecca. And then this is just kind of another picture of it. This shows the cribriform plate, how it's horizontal, and the crista galli is perpendicular to it, and then the perpendicular plate. And then you've got some sinuses that you would hit too. So, okay, next slide. And just in case you're wondering, rhinotelexis is the medical term for nose picking.
Or digital manipulation.
Yes, exactly. We've thought way too much about this. So, all right, and the next slide. Okay, which bones make up the nasal septum? I know you guys know this. Yeah, right, and what part of the ethmoid more specifically? Perpendicular plate, right. We've got a perpendicular plate, and then we've got a cribriform plate. So, okay, and next slide. Ethmoid vomer, perpendicular plate. Yeah, and just remember the vomer is inferior to the perpendicular plate.
Can you come back and teach this?
I would love to. All right. Yeah,
1.5 credits.
What's that?
Okay, so 1.5 credits. Come on back.
1.5 credits? Yeah, I would. Sorry, I'm just checking my thing again. All right, let's get to the next slide. Okay, Halle Berry. She's very beautiful, and she's got tons of nice features, but the one I want to focus on, cheekbone. And what did we say the cheekbone was made of?
Zygomatic process of the temporal bone and the temporal process of the zygomatic bone.
Right, yeah. Sorry, my brain's catching up. Yeah, and together those are called the zygomatic arch. So if you go to the next slide, you'll see cheekbone, zygomatic arch, zygomatic process of temporal bone, temporal process of zygomatic bone. Great. Okay, next one. Okay, and I just wanted this so you could see how they kind of stick out a little bit. So, okay, the next slide. All right, Owen Wilson, very cute guy. What's up with his nose? What bones do you think I've read before in interviews, I think he said he broke his nose playing football or something. So let's talk, what bones did he break?
Well, the nasal bone seems to like
Nasal
stick out.
bone, right, and then we talked about the... So, yeah, but see how it kind of bends? That's probably the septum being deviated. So, yeah. And then he could have more, if he had internal injuries to the inferior nasal concha, that more to the ethmoid. So if you get to the next slide, you'll see. So the fractured nasal bones, that's what kind of gives it that kind of munchy appearance, And then the deviated nasal septum, that's the vomer and the perpendicular plate of the ethmoid.
That's a good picture.
Yeah, I like it. That's gone all over the place getting pictures. All right, next slide. Okay, I just included a little bit extra information. Nasal trauma can be anything from nosebleeds, swelling, bruising, blood clots, fractures, chemical injuries to the nasal interior, obstruction by foreign object, talked about. Next one. And then external trauma can be caused by motor vehicle accidents, sports injuries, falls. And then internal trauma, nasal piercing, cocaine or other illegal drugs, that's a big one, picking or scratching. So, okay, next slide. Okay, this is a good view because there's something that we haven't seen before on here. That's the sagittal suture, and that runs between the parietal bones. So that's right on top of your head. And really, the only time you'll see the suture is from this view, from this superior view. And then landoid suture, occipital bone, obviously that's the posterior of the head. This is the front. So frontal bone, zygomatic, coronal suture, we said was like a crown on top of the head, and then you can kind of see the nasal bone sticking out there. Okay, next slide. All right, sutures. Let's talk about sutures. Does anybody know what's different about a baby skull versus an adult skull? Yeah. Whenever you pick up a baby, a new mom's like, oh my God, his soft spot. Mine is soft soft spot, the fontanelle. So if you get in the next slide, we can see. There's an interior fontanelle and a posterior fontanelle. This is membranous tissue. Do you guys know why these exist? What would be your best guess as to why?
For growth.
For growth, exactly. The brain is going to grow faster than the bones. So you don't want to restrict the growth of the brain by having a solid bone on top, a helmet kind of thing. So that's why you have these soft spots, and that's why you have to be very careful with the baby, because part of their skull is unprotected. You know, it's like this is fine, but right here that could be a real problem. And if you go to the next slide, there's actually a disease, a disorder. It's called, I'm not sure how to pronounce it exactly, craniosynostosis. This is basically when the sutures close too early, and it impedes the growth of the brain and the baby. It's very serious. So you don't want these sutures to close too early. The sutures close naturally between 1 and 19 months. Different sutures close at different times. I didn't write them all down because it's not really something you need to know. But if the suture that's supposed to close at 19 months, if that closes up at 12 months, that's big trouble. That's not good for the baby. Okay, and all right. So I've got. Okay, we're gonna do a group learning activity now. It's just very informal. Maybe get into groups of like 3 or 4, whatever. Get out a sheet of paper, and what I want you to do is, Rebecca, do you mind just advancing the slide?
Next slide?
Yeah, please. Okay, back to nose picking. What's up with this guy? I want you guys to work in groups. I know, isn't that horrible? What I want you to do is just take 5 minutes, work in groups, and just brainstorm. I want you to say everything you see. Use your empirical evidence, your observations, to what bones are involved, what possibly happened to this guy, what's going on inside, what could be the cure for it, would you refer him to somebody? You know, just we'll do, it's about 10 of, yeah, we'll just go until like a couple minutes before 2, and if you guys can just write it down, and I'll collect the papers when we're done just for my professor, if you don't mind, and it doesn't have to be anything neat, it doesn't even have to have your names, just, you know, some brainstorming. So you guys can go ahead and do that, and, what's that?
What bone is involved?
Just anything you can think of. Bones that are involved, what you might think went wrong with the bones, what happened to him that caused this. Just be liberal, you know, try everything. Just throw it all out there.
I don't know where you got that.
It's disturbing, I know. So,
No, he's in your group.
yeah, just there's really no wrong answers. I just want you guys thinking about this. Kind of just get the ball rolling.
Well, the septum is obviously not there.
Yeah.
I would say, what's the bone on the inside of the eye? Black and white. I'd say it's probably compromised.
Yeah, it's hard to tell if he even has another.
I'm hoping they photoshopped this.
Yeah. I don't. There's some crazy stuff.
So what's happening with what's those things called? The things that sound like seashells?
Oh, contact?
What's happening with them? Do you want me to shut up? I will.
No, I appreciate your input.
That's a bone, isn't it?
Yeah. The inferior is.
Did you put the vomer thing there? Because the vomer and the, well, that would be the.
Vomer is more apt.
The
face.
Okay. What does the vomer go with to form the septum? Particular plate of the.
Well, apparently maybe that's more shift back.
I think both of those are probably compromised.
Compromise.
I
That's
know.
the word we needed to write.
Yeah.
We're like missing / broken
There's a lot
/
going on.
contact.
Yeah.
What has happened to his eye? Has anybody ever just thought of what has happened to his
Eye
eye?
is missing first thing on
Doesn't this look like something out of Game of Thrones?
It does. It's, all we need is a dragon.
How do we know his eye is missing?
That's what I said.
Well, we
But
don't.
how can your eye come through your
Yep.
tissue like that?
It's squished, if nothing else.
Yeah. Ask the question. I mean, if you
Before
guys
it's
want to
like
write questions
It's
down,
missing.
like what what you would like to further explore. Like, what kind of X-ray would you like to have? What kind of, you know, and so what further tests would you know, how would you get
You
to
gotta have some spare time.
There's all kinds of stuff you could have.
Fingers weak.
Yeah, I know. That chromoform plate isn't a match for that finger.
A psych evaluation.
Yeah. Possibly rehab.
Oh yeah. Possible
Yeah.
cocaine.
I just want you guys to brainstorm.
You know
write it
what?
all
That's a
down.
definite Photoshop because his finger is bent a little bit.
I was
Doing
thinking the
this
same.
number.
So he's obviously got something wrong with his finger.
Yeah.
What bone is that?
Right.
Phalanges or something? I didn't know. I can't remember.
Tarsals.
Yeah.
These are tarsals, so these are phalanges? Yeah. I think.
I remember there was one, something about Tilly's grandmother may come home for the bones, and I can't remember.
I think he got shot.
Did
he get shot? Put that question down.
There you go.
Got shot through his nose.
Yeah.
His hand looks like a pistol.
I don't think
There's no external, I don't see any externals, so I kind of wonder.
It went right through there.
Totally Photoshop.
Yeah, maybe Photoshop. It could be Photoshop. I don't know.
Photoshop.
I don't know this person personally or.
It's
Oh, okay.
And this person is alive, you know. He's hoping he's
Supposedly, yeah. But I mean, the
There's
spirit
no
of the
blood.
exercise is just kind of to brainstorm, name the bones, kind of do some critical thinking, put things together, you know.
This is your maxilla.
Really, let's write a whole story. This could be like on NCIS.
Right?
Exactly.
Right? That's your maxilla right here, right?
what's that?
Yeah, I can see how the maxillary could be involved, maybe, yeah. Yeah, so, and you think about the orbit, like what bones make up the orbital ridge? I think there's 4 of them, I can't,
Oh, there's
see the
4?
diagram.
Nasal bone.
The maxilla is part of
Frontal,
the.
maxillary, lacrimal.
Yeah, maybe zygomatic
I don't know.
part of it. I'll have to look that up, so.
How about the zygomatic? Isn't it touching the, doesn't the zygomatic make up part of the inferior orbit?
Yes, yeah. The orbital ridge.
Over here.
Oh, good.
Yeah.
Right here.
Not here.
Zygomatic looks okay.
Course in dental hygiene school, I aced.
All right, well, you guys want to, you have time to get some good ideas down? You want to?
We won't
Okay,
talk about
let's
this.
let's just share. We'll just go group by group. Does anybody want to volunteer first?
Sure.
Rebecca, are you going to go?
Yeah, we're back. We'll go.
Okay.
Okay, we said the eye is missing or squished. Perpendicular plate of ethmoid bone is missing or broken. Inferior nasal conchae is displaced. Vomer and perpendicular plate are not attached. The sinus walls may be compromised. We recommended to do a SEP, a pano, and a Waters projection.
Wow.
Possible cocaine user and maxilla bone and lacrimal bone are compromised.
All right, great, very good. You guys want to?
Cephalometric X-ray will be better than also.
Okay, why do you say that?
Because the head is involved.
Okay, good. Anybody have anything to add to those 2 groups? I don't want to leave anybody out.
It's like a pan.
No, so what is a cephalograph?
Cephalometric.
I didn't know how to spell it.
Cephalometric, you do when you do the braces on the ortho.
Yeah.
It shows your
I know what it is. I'm
size.
saying what.
And the water gate, doesn't it come from the top?
The water gate.
Water projection? Water.
Watergate did come from the top.
Water.
I came from all the way from the top. So. Speaking of which, New House of Cards is out.
I haven't watched that, but that's probably going to be my next.
So good. So, all right. Anybody want to add anything else to feel like you? Okay.
We were saying bacterial infection, childhood trauma.
Oh, good one.
Yeah, good. Yeah, I like all these answers. Rebecca, if you go to the next slide. Okay, this is something called septal perforation. I was thinking for him to get his finger sideways through both, sides of the nose. There's either got to be septal perforation or maybe it's missing altogether. Who knows? If you go to the next slide. Okay, just to confirm, we said the vomer, we said the perpendicular plate of the ethmoid, we said the inferior nasal concha, middle nasal concha, possibly lacrimal. Anybody say the sphenoid? I don't know. Okay, sphenoid. And then we've got the zygomatic bone and the maxilla and the frontal
Oh, yeah, frontal.
Frontal, yeah, that's up above the eye. That might have been a little bit high, but who knows. So anyway, that's it. So, okay. And Rebecca, if you go to the next slide, okay, so basically we're going to wrap up. I don't want to take up too much of your time, but just to remind you of the instructional objectives that we had, 3 learning styles and 3 memorization techniques, functions of the bones in the skull, identify the bones in neurocranium, viscerocranium, associated landmarks, define terminology and views of the skull, and then possible diagnosis like we just did on empirical evidence. So I feel like we met those objectives really well. You guys did a great job, and I thank you very, very much.
Thank you.
Thanks. And if you go to the next slide, just a great job. It's a little bit blurry. I don't know why. Okay, and then I just got a few more questions. If you guys just want to real quick, just 5 more.
Yeah.
Okay, next one, Rebecca. And here's some additional material. And like I said, I'll give Tanya this so she can email it to all of you. Just the Quizlet.com's got a lot of flashcards. And, then they have a dental anatomy app at Google. I think it's free. And then the animatedteeth.com. And some of it's very, very basic, and then some of it's a little more advanced. So, okay. And if you want to go to the next slide, Rebecca. Okay. Just real quick questions. The learning style that is best described as a hands-on approach is? Kinesthetic, right. And the next one. The bones of the skull serve all of the following functions except?
Support of vertebral.
Right, support the vertebral column. Okay, next question. Which of the following bones is not part of the viscerocranium? Not part of the occipital, right, it's part of the neurocranium. And next. All right, and which view of the skull would provide the best view of the anterior cranial fossa?
Inferior. Anterior cranial fossa.
Yeah.
Oh, wasn't that it's interior.
Interior, yeah.
Right, interior, and that's the one where you're looking down where the top of the skull is chopped off. Okay, and the next one? Okay, this is like a little bit more of a case study, so we're going to use a lot of our different information. So the patient presents with dry mouth and moderate gingival inflammation, especially on the facial surfaces of the maxillary anterior teeth. The patient's medical history shows that he is taking no medication. The patient has noted that he was in a car accident 5 years ago, but there is no other significant findings. While speaking to the patient, you notice that he is breathing through his mouth. Based on this information, which of the following conditions would the patient most likely have?
Deviated septum.
Deviated septum, yeah. People with deviated septum, a lot of times they're either exclusive mouth breathers or they supplement by mouth breathing, and that's going to lead to dry mouth, which is going to lead to gingival inflammation, more plaque, more tartar, more infection, and and in the car accident, even though he didn't report a broken nose, he could have broken it and not even known. Yeah. So deviated septum, that's the best answer. So, and that's it. Thank you so much.
Thank you.